Good evening. I am Dr. Pradeep Shantagiri, consulting physician at Kasbekar Medgood Hospital, Belgavi. I have been practicing since last 25 years. Today we'll discuss something about high blood pressure and how to prevent it. Generally, everyone would like to have a healthy or a normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels, and this creates pressure against the walls of blood vessel. This is called as blood pressure. Normally, in a healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices. For example, not having enough regular physical activity, obesity, smoking, alcohol consumption, stress, and high salt intake. There are other risk factors that can also increase the risk of developing hypertension, such as age. As people get older, the arteries can stiffen up and narrow as excess fat builds up. Family history of high blood pressure, one or more close family members with hypertension increases person's risk of developing the condition. Excessive salt intake also is known to raise blood pressure. Not eating enough food with potassium can increase blood pressure and the risk of stroke and chronic kidney disease. Eating processed and fatty foods increase fats throughout the body and make the heart work harder to push blood through the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further to high blood pressure. Another one is stress. Reacting to stress in unhealthy ways or not managing stress adequately can also increase the blood pressure. Moving on, hypertension does not have any obvious sign and symptoms. That is why it is often called as a silent killer. It puts people at risk for several diseases like cardiovascular problems to kidney problems, stroke, and even eye damage and blindness. Hence, early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to know whether a person have high blood pressure or not. Generally, when symptoms do occur, they include morning headache, giddiness, tiredness, visual disturbances, buzzing in the ears, fatigue, nausea or vomiting, or imbalance while walking. If a person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be diagnosed easily. It is usually measured with an instrument called sphygmomanometer. A blood pressure is recorded in two numbers. One is systolic, another one is diastolic. Now let's try to understand what do these numbers actually mean. A healthy or a normal blood pressure should be lower than 120 by 80 millimeters of mercury. It can also read as 120 over 80. Here, the upper number indicates systolic blood pressure, which means the pressure in the blood vessels when the heart contracts. Whereas the lower number indicates diastolic blood pressure, that means the pressure in the blood vessels when the heart rests between the beats. If blood pressure level is more than 140 by 90, then the person is likely to be diagnosed as hypertension or is having high blood pressure. If a person has a blood pressure levels higher than this, then he or she is at risk of developing serious heart and kidney diseases primarily. The risk can be prevented and reduced by taking steps towards a healthier lifestyle, such as a regular exercise, healthy diet, quitting smoking, and regular blood pressure monitoring, stress management, adherence to medicine, and restricting salt intake also. If blood pressure is successfully controlled with such lifestyle modification, then it might avoid or delay or reduce the need for medication. So let's look at these strategies one by one. Regular exercise or physical activity. Exercise can be a drug-free approach to lowering blood pressure. Regular physical activity means will make a person's heart stronger. If one has a strong and a healthy heart, it can pump more blood with less effort. So if heart has to work less to pump, the force on the blood vessels also will decrease and lowers the blood pressure. In other case, as we all are aware, that age and weight gain are the two major risk factors for high blood pressure. So if the blood pressure is at a desirable level, less than 120/80, then exercise can help prevent it from rising as you age. Regular exercise also helps you maintain a healthy weight, which in our opinion is an important way to control blood pressure. One should aim for at least 30 minutes for aerobic activity most days of the week. High blood pressure level can be reduced by doing regular structured exercise such as swimming, walking, brisk walking, jogging, cycling, etc. A healthy diet. Diet also plays a very important role in controlling blood pressure. A diet with a high intake of vegetables, fruits, and whole grain is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, and one can adopt a dietary pattern such as a DASH diet or a Mediterranean diet, eating less saturated fat and a total less fat, getting plenty of potassium, limiting the amount of sodium in the diet. This DASH stands for dietary approach to stop hypertension diet. So eating a DASH diet that is rich in whole grains, fruits, vegetables, and low-fat dairy products, and less saturated fat and cholesterol can lower one's blood pressure by up to 10 millimeters of mercury. Now, reducing the sodium also in our diet can reduce the blood pressure. Even a small reduction in salt intake can reduce the blood pressure from 5 to 10 millimeters of mercury. So to decrease the sodium in your diet, you should consider certain tips, like you have to read the packed or preserved food labels. So the packed item which contains a high sodium content should be avoided. As the same holds true for beverages also. You have to eat fewer processed foods. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing. So you have to avoid the fully processed packed items, and don't add salt to the dish whatever you are taking. Use whatever is there which is been cooked. Salt used during cooking. Now, the third option will be quitting smoking. So stop smoking, and it helps to reduce blood pressure, and most of the arterial tone returns back to normal. Quitting smoking can effectively reduce your heart disease also and improves your overall health. Regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up their blood pressure. Hence, most often I advise patients to have a self-monitoring of their blood pressure levels. Self-monitoring helps person to measure BP at different times throughout the day and over a longer period of time. It also assists doctors to get more complete picture of person's blood pressure readings at different times. Further helps us in better prediction of cardiovascular morbidity and mortality rather than single routine blood pressure measures that occur during a clinical visit. Stress management. By learning how to relax and manage stress, one can improve emotional and physical health and lower high blood pressure. Stress management techniques include exercising, listening to music, focusing on something calm or peaceful, and meditating. So, it is also important to adhere strictly to medicines. A medicine to lower blood pressure may be recommended by doctor if your blood pressure is consistently high, usually above 140 by 90. Adherence to medicine is very important as it controls your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit and a healthy life. Adopting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain a normal blood pressure levels with regular monitoring and preventive care. Thank you.